to talk a little bit about some of our antibiotic stewardship efforts for producers in the pork industry. What I want to emphasize here is that this aligns very closely with those efforts of the American Association of Swine Veterinarians, and we work very closely with them on pretty much all of these activities as well as with our other commodity groups. I'm going to walk through the background of our antibiotic stewardship in the industry and then talk about our new initiatives. You know, this has really become a very important topic, as we all know, increasing interest in it on several levels, from the public to the regulatory aspects, and the pork industry has really taken a proactive approach, particularly in the last year with respect to our education, research, and communications, and I'll talk through some of that programming as well. So we have a long history of antibiotic use guidance in the pork industry. It really starts with our We Care ethical principles, and these are the set of ethical principles by which pork producers undertake their pork production best practices. You can't see all of these here, but I'll highlight the ones that really relate to public health, food safety, and antibiotic stewardship. So certainly producing safe food, managing the health of the herd to produce safe food is one of the ethical principles, and ensuring practices to protect public health. So that means using management practices that are consistent with producing safe food and managing as well the use of those animal health products like antibiotics to protect public health. And so within this, U.S. pork producers closely monitor the health of their herd, and when necessary, they're going to want to use antibiotics or have the availability to use antibiotics to protect the health and welfare of their animals. Within the industry, for those of you who aren't familiar, we use antibiotics in a number of different ways for individual treatments, which can be by injection or oral, and certainly for group uses in feed and water. And we'll talk a little bit about the regulatory changes and what that means to producers and how they use antibiotics on the farm. And of course, we work closely with our veterinarians when we use antibiotics, and that's part of our PQA Plus programming, our pork quality assurance programming, and has been for a very long time. This is an outline of the evolution of our antibiotic use guidance in the industry, so I'll walk through each of these, but it just gives you an idea of over time how this has changed and certainly evolved. So our pork quality assurance program was introduced back in the late 80s, and that really started as an animal welfare food safety program, and over time it's really moved towards incorporating several different pieces, including antibiotic use guidance. We have a rewrite this year which involves public health, an influenza piece in there, as well as worker health and safety and the environment. In the late 90s, we had the Judicious Use of Therapeutic Antibiotic Guidelines for pork producers, and this aligns with the American Association of Swine Veterinarians and the American Veterinary Medical Association's Judicious Use Guidelines, and they specifically address how we use antibiotics for disease prevention, control, and treatment. We also had a position statement from the Pork Board, which is our board made up of our producers, in the early 2002, and I draw your attention to this because I'm going to talk about a revised statement, but really it was interesting in revising the statement that not a huge amount has changed. So really the focus has always been on protecting public health, food safety, animal health and well-being, and the environment, and really making sure that we have antibiotics that are effective and available to use as needed, and that changes made in using the antibiotics, whether that's policy or whether it's on the farm best practices, are based on using sound science. In 2006, we had the Take Care program, so really that was sort of drawing pieces from the PQA Plus program and incorporating more detail for producers in specific guidance on how to use antibiotics on the farm, and I'll talk a little bit about that as we go into pork quality assurance. We had the Pork Quality Assurance Plus program, and this is where we started to really incorporate those other pieces that I talked about, the environmental pieces, the antibiotic use guidance in the Pork Quality Assurance program. And for those of you, most of you probably are familiar with the different programs in the different industries. They differ a little, but we had a discussion yesterday in our breakout session about this. While we may have different definitions of what stewardship is, we generally have sort of the same principles that guide it across the commodity groups. And so our quality assurance program is required by all the major U.S. pork producers, which means that our producers have to go through the training of it, and then there's an external auditor, and it is renewed every 3 years. Within that program, these are our good production practices. This is, in our rewrite, this will look a little bit different next year, but in the last version of it, we had good production practice number 3, which is using antibiotics responsibly. And so within that, it walks through a set of principles, but also guidelines, and that's designed for producers to think about not only related to residues, this is related to how you use antibiotics on the farm and how that will impact public health and animal health. So thinking before you're using them, what are the appropriate steps to decrease the need for the application of antibiotics? Are there other things you can use in your toolbox? Is there better biosecurity you can put in place? Is there a vaccination program that you can have? So working through with your vet, what is your whole herd health program before you choose to use an antibiotic? When you do choose to use it, what are the advantages and disadvantages of using this antibiotic? So what are those balances in choosing that? Does it provide measurable benefits? Fully implement the management practices for the responsible use. So how do you use it properly, reading the label, keeping records, and making sure you have that veterinary client-patient relationship in place as part of your herd health program. In 2015, which is this year, we actually brought together, this didn't start as wanting to write a new position statement, but we had a working group come together, which was made up of some producers, certainly a number of academic experts from the different institutions that had a background in antibiotic use and resistance. And we were talking about strategic direction for the industry. And in doing that, we sort of backed up and thought about, well, where are we now, and what are our policies and position statements, and what are those things that are important that we need to be thinking about? You don't need to read all this, but I'll draw out some of the important pieces. And part of it is it does align with what we already had, but it's thinking of moving forward as well and what we need to be doing. And that also involved the development of a policy that was approved by the board this year. So some of the pieces in there that I think are important are that using antibiotics responsibly is the key objective. So making sure when we use them that we're thinking again about those pieces in the PQA plus, what are the advantages and disadvantages, what are the other pieces that can be in place to minimize their use. Preventing disease rather than treating disease is very important, and an important use that producers want to be able to maintain. We know that being able to prevent disease allows us to protect our animal health and welfare rather than moving to a clinical situation where we're treating individual ill animals. And protecting the efficacy of antibiotics by using them responsibly, not only to have the efficacy for human health, but we need them for animal health. And sometimes that gets forgotten in our discussions because we're talking about the public health outcome of all our activities, but we also have to have those antibiotics available to be able to treat our own animals and have a safe food product. And certainly reducing the need to use medically important antibiotics is a very worthwhile objective, and that means looking at all those other pieces on the farm that we can do so that we can have antibiotics available when we need them, but not necessarily as our frontline defense if we have other herd health programs in place. Moving into this year with our board meeting in June, they really decided that we needed to take a very proactive approach. Some of the other speakers have talked about the different pressures out there. There's a lot of regulatory activity that's occurring, and we need to be aware of that, have our producers aware of it, and be aware that they need to comply with this and have their veterinary patient-client relationship in place. We also have a lot of pressure from retailers, and we have a group that works specifically with our retailers and the public through the retailers. The pressures come to try to talk through some of those pressures that are occurring and also educate them on how and why we use antibiotics and the importance of having them available to animal health. So the pork board identified a 3-point antibiotic stewardship plan, and the 3 focus areas within that for 2016 and 15 starting now, but certainly allowing our budget to very much support these as a priority for the industry are education, so educating producers, number 1, on how to use antibiotics responsibly or continuous improvement of that, but also the changes that are occurring with respect to the regulatory changes. 2, research. It is always historically we have had antibiotic as part of our research priorities, but this year we have a very strong focus on it. The board dedicated just under, I think, $750,000, which for us is a very good portion of our budget to allow some of those research projects through external investigators, and certainly a lot of those end up as pilot projects that can go on to larger funding. And then communication outreach. So that's to all segments of the pork chain, and that will continue to be an emphasis with very special emphasis on pig farmers and the upcoming rules, and certainly working with our retailers. So with respect to education, we've started I guess you could call it a campaign, but certainly working on making our producers aware of the impending changes. And I work very closely with our communications lead, Mike King, on this. And this is, we're all aware of this. I probably don't have to go through this, but all the changes that are occurring with respect to Guidance 209, 213, and the Veterinary Feed Directive, and producers understanding that this means the way they use antibiotics on the farm is going to change. So their availability of going to get some of the over-the-counter antibiotics will no longer be there. They're going to need to make sure they have that veterinary client-patient relationship in place. Particularly, this concerns us with respect to our rural producers and making sure that they have a veterinarian available to them when they need them, that they can access, and understanding that the way they used antibiotics, for instance, for growth promotion and nutritional efficiency, will be changing, and they have to be aware of that. We have located a resource center at pork.org/antibiotics, and that's all our resources, our FAQs, additional clarifications that arise from FDA, and that's continuously updated. And it's a regular front page feature on pork.org. So for our producer audience, that's the way we communicate with them, is through our various newsletters as well as our website. And this allows them a resource. We had a similar one for PEDV, which worked very well. We've also done several newsletters, and we'll continue to do these as things change, but to start to increase their awareness. So this was earlier in the year. We had a Checkoff newsletter which walked through what these changes are, what they can expect, what they should be aware of. We had American Association of Swine Veterinarians and a veterinarian have a little piece in there as to what that means with respect to working with your veterinarian. And we also had it in our magazine for the summer. So that reaches a lot of our producer audience, certainly not all of them, and we have a continued effort to reach all of them. Our producer messaging will really is focusing on a be ready theme. So be ready. Don't let this catch you by surprise that things are changing, and thinking about how you use antibiotics and what your whole herd health program is. And we emphasize key to-do points such as understanding the regulations, strengthening your existing VCPR, communicating with your feed mill, making sure you have that relationship in place, ensuring that you have record compliance, continuing your focus on pig health and welfare, and visiting our website regularly for those changes. Producers have a lot of questions, as do the veterinarians, and we do as well. And as we get answers to those, we continue to update that. We have a lot of producer venues, so we have our trade shows starting in January, February, March. I was sort of hoping I could clone myself to go to them, but I don't think that's going to happen. So we have a lot of people with our outreach out there reaching the producers and providing presentations as well as print materials. And we use some of our very traditional Checkoff communication materials to get our farm media coverage, because our producers are all very different. Some are well in tune with sort of the Twitter and all those other technologies, and others still, like some of the traditional communications. So working through all our venues to educate them, and running ads in print and online as well. We have one that's out there right now that you may see through some of the media. And we're also working on leveraging those who have face-to-face interaction with producers, so not only trying to reach them through hard copy and online, but having somebody talk to them in person. So that's our state pork associations, our extension agents, our veterinarians. We're working closely with ASV that we're in line with our communications, and they're talking with the producers on what's changing and what's happening. And also, another population which is important to us, that this is going to come as a bit of a surprise to, is our show and pig breed associations. So all the kids out there, who are active in these areas, this is going to impact them as well, and understanding that they need to understand what the regulations are, and also understanding that they need to understand responsible antibiotic use. And we have a youth PQA Plus program that's designed specifically for this segment of the population. Our other focus in our stewardship plan is a research focus. So in order to develop our research focus, we typically bring together subject matter experts in our committees, and we establish our priorities. So I have a producer public health and workplace safety committee, and that's made up of producers and academics and some external parties. We establish our priorities each year, and we do a research call in November. This year was we have a research call, but we also have a separate research call specifically for antibiotics, and we brought together a task force to establish these priorities specifically. And these are the ones that are for 2016. This is available on our website. Before I go through these, I'd also like to say we'd like to be as transparent as possible with these, and also to garner as much input as possible. So we've met with some of the pharmaceutical companies as well as the retailers to get input on our strategic plan as well as our research. So if you have comment or feedback on these, please bring it to me, because these will evolve and continue to evolve each year. So our priority research areas for 2016 are looking at number one, looking at preventative uses of antibiotics at therapeutic doses. So analyzing and assessing those, we know it's a very important use, and we want to be able to demonstrate that, but also look at when we use them and how we use them, and are there ways for continuous improvement for preventative uses. This also applies to specific animal population antibiotic treatment, which really means mass treatment, mass or whole group treatment versus individual treatment. Again, a production practice that is important for pork production, and one that has a lot of public pressure on why do you treat animals en masse. And so being better able to, number one, explain that, and number two, take a deeper look at it. Are there different ways to do this, or is there continuous improvement within this to optimize swine health and public health? On-farm challenges to antibiotic record keeping. So antibiotic record keeping is part of our PQA Plus programming, but it's identified as one of the potential weaknesses. There's certainly always room for improvement here. So looking at, this is maybe a bit more of a behavioral or qualitative assessment, but looking at what are those challenges to antibiotic record keeping on the farm, and identifying strategies to improve that record keeping practices. And then number four is looking at the environmental fate. So this one is, and it was nice to have the speaker before, and I'd like to talk a little bit more about that. This has been an area we've had in our research call for several years. It tends to be a very gray area for us. There's not a lot of information out there. We've had Dr. Singer do a couple of systematic reviews and identified that in the end what we really need is more information. So it's been identified by several external reviewers of these priorities as a priority area, but I think understanding that it's still a very gray area, and that this will take some time, but we'd like to continue to focus on this area. Particularly if you have feedback on this, I would appreciate it, because I think the more we can refine it or move towards some sort of, I tend to say we're not sure when we get the results. We get a lot of the gene levels, and what does that mean in terms of animal health and public health. So better understanding this area will be really valuable to the industry. And then again, just looking at strategies. What are those other strategies that are available to protect herd health and minimize the need for antibiotics? And that's really a focus on across our director groups, working with the swine health directors, the swine health director, the food safety director, and the environmental director, and cross-disciplinary projects to protect herd health and minimize the need. One of the other areas that is the focus of this conference, as we know, is the continued focus on metrics and what and how are antibiotics used in pork production. And that's certainly been a topic that's been a priority for all of the commodity groups. We've worked together to develop general principles related to stewardship. We've also talked a lot across the commodity groups as to what those metrics are. So we know that volume doesn't provide us with a lot of information. It's easily miscommunicated and misinterpreted. But what is a metric that is valuable to the producers and also that's valuable to those that better want to understand how we use antibiotics? So we've dedicated a subject matter expert. Dr. Peter Davies is a swine health faculty at University of Minnesota. He's on sabbatical and he began working with us in October. And he's going to look at models and metrics to assess antibiotic stewardship in the industry. We started this project really about 2 years ago. We took a trip to Europe and we met with Denmark, Holland, Germany, and Belgium to look at some countries that were in the different stages of responding to the EU directive on collecting antibiotic use data, how they were approaching that, whether that was reaching their public health outcome. We found a lot that really it was just quantitatively reducing the volume, and we want to better understand does it reach a public health outcome. So Peter's going to continue to work on that. And across the commodities, I know Dr. Singer's working on it in poultry and Dr. Apley in beef. And that's a great combination to take a look at this. I think we've identified that some of those metrics may be different across the industries. We don't really know, but we're looking forward to what that will reveal. I think there's a lot of pressure right now to have an immediate answer, and I think we want to make sure we give due diligence to this and have a metric and model that's valuable to all those involved, so it can be a continuous improvement for producers using the antibiotics as well. Just in terms of some of our other related industry activities, my position has been in place for probably about 10 years now, which I think is a valuable position to have to be able to work directly on producer and public health issues. We have a committee that works specifically on producer, public health, and workplace safety, so antibiotics is a huge part of this committee. Various topical working groups that focus on different aspects of antibiotic use in the industry. And this year we've assembled a blue ribbon panel of third-party animal and human health experts. And this is intended as to provide input and review of our strategic planning, and as third-party human and animal health experts along with consumer marketing to provide us with feedback that we can use for our continued evolution of our antibiotic stewardship. And that's just sort of getting into place right now and has been a real initiative of our board and leadership over the past couple months. So in summary, producers support the responsible use of antibiotics in both human and animal health. Professional veterinary input is a very important piece, and we'll continue to strongly emphasize that and work with the American Association of Swine Veterinarians. Research, I'm in the Science and Technology Department. We fund research in all our 7 areas, and that's always been a very strong focus and a continual focus of the board to have budget available for research to support changes and improvement in best practices, and that science-based principles are an important, really are an important basis to develop our producer guidelines on antibiotic use.